when lives are on the line.
Are there any obvious injuries?
These men and women will risk theirs
The lad who was driving got blood coming out of his face.
to save yours.
RTC trap.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear. There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The two Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof.
Oh yeah. He's got a big cut to his head.
5 million people rely on them
He's absolutely locked in. Okay, good.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high stakes.
18-year-old motorcyclist, unconscious, head injury.
Helmet removed on impact.
Only thing I want you guys to do is, on that scoop, no straps, 2 on each side, onto the trolley. Is that all right? I'm concerned that he might have some bleeding on his brain.
High risks.
Open fractures are, well, very visually quite disturbing, really horrific for the patient.
Is your thumb actually in it?
My thumb's on the end of the bone. Put anything back in place, I'll have as much drugs as you've got.
And high drama.
We're heading to a gentleman that's fallen at a building site. We believe he's in traumatic cardiac arrest.
Speed's good, height's good.
He was just sorting the string line out, ready to do the block paving. Just as he was coming across to adjust it, collapsed onto the floor. Just started CPR. Hull is one of the UK's most famous seafaring cities, a booming port on the Humber estuary, overlooked by the towering Royal Infirmary. For 500,000 people, it's the local hospital. And where A&E Dr. Chris works, when he's not flying on Helimed 99.
What are we going to?
18-year-old motorcyclist, unconscious, head injury.
It's not a good combination.
Chris is heading back to the outskirts of Hull.
Anyone who's unconscious after a traumatic incident is a concern to us. It may be due to their airway being obstructed. We may need to open that using some techniques. It may be that they're short of oxygen, that they're breathing, or that they've bled, or it could be a head injury. So if you're unconscious, that's a bad thing.
More details are coming in.
Reduced GCS, doctor on scene, helmet removed on impact.
Did that with some fast then.
So it sounds like might need an RSI.
They're planning to anaesthetise the patient. Dr. Chris knows the area well.
From Singlethorne to Hull by road is probably about 20 minutes, 25. With the secondary transport, it's probably quicker going by road. Okay.
Have I got an ETA for crew?
ECA is just getting there now.
Paramedic Rachel's job is to find the scene of the crash.
So it's the other side of that road. There's a road going through that village, and it's just out the other end of that village where those trees are.
You got the scene coming up at this T-junction at 1 o'clock.
The crash involves a biker and a car at the entrance to a lay-by.
Gary, just below you is where they shoot shotguns. I can't see any clays. Where are you looking? Back at your 6 now. Okay.
So there's wires in that field. Where are they? Are they going straight across the field?
I think they go up the field that way. This
And then there's these going that way. And they're going along.
Pilot Gary's dropping his medics next to the crash.
Can we get out of this field? Get straight out here, then straight in front of us, mate. Cleared out the disc. Thank you. Thank you.
The biker's body took the brunt of the collision with this car. He's only 17.
So, only thing I want you guys to do is, on that scoop, no straps, 2 on each side, onto the trolley. Is that all right?
Yeah.
There's no time to waste. Lewis Foster has a serious head injury.
Forget straps, just lift. C-span. You get there, mate.
Ready?
There you go. Yeah.
Steady, lift. Which is head end? Right, okay, just stop there. Stop.
The team are turning the road into an operating theatre.
Okay, guys, let me have a quick look.
Yeah, I don't know how much is in that.
What's his name, Lewis?
They're going to put him into an induced coma to protect his brain. Watching on will be his family, who have rushed to the scene.
So we're going to RSI this kid, okay, put him off to sleep, some anaesthetic drugs, okay?
It's a potentially dangerous procedure. Lewis's life relies on everyone doing their jobs perfectly.
Okay, buddy. Nice and calm.
Nice and calm. Calm down. You're doing really well.
Chris knows how distressing this will be for his family, and so part of his job is to keep them informed.
Hello, my name's Chris, I'm one of the doctors. Hi, Chris. What we're going to do is, he's obviously got some serious injuries. I'm really worried about his head, because he's been agitated. So we're going to put him into an induced coma right here and take him to Hull Royal to get him sorted out, OK? Just because that will stabilise him a little bit, OK?
Although Lewis is an inexperienced biker, it seems like he was not at fault. Every year, dozens of bikers are killed by cars turning in front of them.
OK, buddy, we've got you.
So we're just going to do a quick checklist. Need just silence from everyone if we can. All right? Happy, mate?
Yep.
OK, go ahead.
Patient position optimised.
Yes, it is.
The oxygenation in process.
It is. That's running.
Cannula in place.
Nasal cannula in place.
Suction unit in position and switched on.
Yeah, switch on. Happy?
It's vital they follow a detailed checklist.
So we're going to go, I reckon he's about 70.
Yep.
So what I want you to do is give the fentanyl, so give 4 mils of that,
Roger.
14 mils of the ketamine,
Roger.
and then all of the rock.
Okay.
You happy with that?
Yep.
Okay, good.
This procedure has been proven to save lives.
So we're going to anaesthetise this lad. So plan A is going to be to intubate, plan B will be eye-gel, plan C will be basic airways, and plan D will be front and neck access. Anyone got any concerns? No. Okay, ready to start. Time now is 3 minutes past 3.
First, Lewis will be sedated.
OK, mate. 60 seconds.
So we're just going to gently bag him for this minute.
That's your minute.
Okay, scope, please.
Then he'll be paralysed.
I've got a grade 2 view, Bougie. Tube on, please.
I've got the boozer.
I've got the tube. Tube's going down. I'm going to take it to 20, 22. Bougie out.
Yeah.
Numbers look good. Cuff up, please. Okay, just gently bag him.
Now they're taking over Lewis's breathing.
Yep.
He's got bilateral air entry.
Yep. All good.
Okay, so we're happy the tube's in position.
Yep. His chest does look a bit caved in, to be honest, but yeah.
Paramedic Matt is trying to identify the rest of his injuries.
Ribs feel pretty much intact, to be honest.
But his chest is a bit caved in.
Looks like it. But
so
this right side feels...
He's not laid flat on the scope, to be fair.
Okay, I've got the head. Do you want to get some head blocks for us, mate?
Yeah.
Right. Put rest of the ambulance service. Paul, can you come and get some straps on him? Then we're going to get him loaded in that ambulance, so we're going to go.
This is any family's worst nightmare. Dr. Chris is doing his best to keep them calm.
We've put him off to sleep with some anaesthetic drugs into a coma to protect his brain. I'm concerned that he might have some bleeding on his brain. I think he's got injuries to his chest as well. So we're going to get him into Hull Royal. I'm going to give him a shout and we'll get him handed over there, OK? Is there anything you want to ask me?
When you say there could be an head injury, I mean, I think he's had his helmet on at the point of impact because it's scraped.
My concern is with the way he was behaving, being quite agitated, groany and things, that might maybe a sign he's got some bleeding there. The only way we can find out for certain is by doing a scan, and then we'll know a lot more. But he's really, really poorly.
Is he?
Yeah.
He's going to have a scan straight away.
Yeah, but we'll get him sorted out in Hull, OK?
Every second now counts.
At the moment, we've had to put him to sleep because he was quite unwell, potentially with a head injury. He's potentially also got chest injuries, so we're having to monitor him quite closely at the moment in case anything changes. He's going by land because we're not too far away from Hull Royal Infirmary, so the doctor and Matt, the paramedic, are going to travel in the back of the ambulance with the crew.
I've got a 17-year-old male who was riding a motorcycle at approximately 2:15. He's had a collision at a junction with a car, high impact collision, thrown off. He's got a head injury, he was cerebrally agitated. He's got a right chest injury and sort of bilateral perineal and right wrist.
Lewis's condition is stable so far, but he's fighting for his life.
Initial GCS, eye opening of 2, verbal response of 2, motor response of 5, so that's 9. ETA is 10 minutes.
Dr. Chris is focused on Lewis's brain bleed, but his patient has other life-threatening injuries.
So at the minute we're just trying to make sure that we're controlling everything possible to reduce any further swelling on his brain. So we're making sure his oxygen levels are fine, and just controlling his carbon dioxide as well, because we know that if you have a very high carbon dioxide, very low, that tends to make your brain swell or make your brain starve of oxygen. I'm also very concerned about his pelvis, because if you actually look at his groin, he's got bruising on the inside of both groins, which can be a sign of where he's collided with the fuel tank. He's also got quite a nasty looking wrist injury, but in the grand scheme of things, that's really quite a minor thing.
Lewis is in good hands. Matt is the air ambulance's most senior paramedic.
By us putting him in a drug-induced coma, drug-induced sleep, if you like, we're actually keeping his brain safe, his breathing safe, and everything else. And we are monitoring it, we're controlling it to keep it as it should be if everything else was normal. At the moment, he's possibly got a brain injury because of the accident. His brain can't control it itself, so we're doing that for him.
It's time for the trauma team at Hull Royal to take over the fight to save Lewis. He needs urgent surgery. On the Yorkshire Wolds, a ground ambulance crew have asked for help from the helicopter team. Paramedic Sammy is on duty on the air desk today.
1623. Yeah, I wonder if you could give us a sit rep reference your patient. Over.
Yes, we've got a 52-year-old female. She's had a fall from a horse, which obviously, given where we are, the state that the patient's in, would probably do with her hens coming out.
The morning shift has just begun, and at RAF Topcliffe, the crew are already preparing to take off for Market Wheaton in rural East Yorkshire.
Confirmed. Dozen harnesses.
Yeah, we're good in the back.
Dozen secure mine fuel.
Paramedic Pete Rhodes will be in charge of the patient's care.
Sounds like she's sustained quite a nasty open fracture to her arm and her elbow. The crew are concerned is the wounds to the extent that they've actually had to put the finger in to stem the bleeding. There's a few things we could be concerned with, obviously, there. We've got a lot of main vessels that do run down your arm. There's significant risk of major hemorrhage there.
Pilot Chris Attrell and paramedic Pete Valance must find the isolated farm.
It's an open fracture, it's obviously on a farm, so it's not a particularly clean environment. Massive contamination risk.
Chris needs to land close to the paddock where the accidents happened, without causing another.
Horses are all standard.
Yeah, we're looking good left for both horse activity and
getting my side.
Pam Hayes was riding the horse with a view to buying it when she came off. Broken bone has pierced her arm.
So is your thumb actually in it? So
my thumb's on the end of the bone.
We could do with try to get some pain relief into you, if that's all right.
If you're going to try and put anything back in place, I'll have as much drugs as you've got.
That might be the case.
Thank
now,
you.
Before we do anything, the most important thing is just feel on there.
She does still have distal circulation, able to wiggle her fingers, but a capillary refill in left hand is reduced by 3-4 seconds.
She was riding a horse round here, trotting, and she kicked him into canter, and she got unbalanced and fell out the side, and unfortunately landed her arm on a piece of wood, which I think that's what did the damage. Very unusual for this horse. He never, the length of time we've had him, no one's ever fallen off him. He's not spooky or any way. She's still interested in the horse, actually.
The team are splinting Pam's arm to reduce the risk of further damage to this already bad break.
So I'm just going to support your arm here. Okay. Right, Pamela, could you move your good hand away from your arm now? Is that okay? That's it. And bring it round to your side.
Take my thumb off?
Take your thumb off, yeah.
Are you sure?
Yes, please. If there's anything that we need to do, we'll do it. It's better we take that out than having your thumb in. Okay, right, put that dressing on there, it's just oozing a little bit.
Oh, my bloody thumb hurts.
Right, I think, do you want to just bring the Sam away, can we?
Yeah.
So we can wrap this round properly.
Oh, sorry, keep taking the Entonox, don't stop taking the Entonox. We'll get
Have you got any pain relief that doesn't involve me getting lightheaded and nauseous? Because I can't be doing with that.
Pam suffers from a medical condition that affects her balance. It may have been a factor in her accident.
Well, what we'll do, we'll give you some ondansetron, which stops you from feeling nauseous, and we'll give you some morphine.
Yeah.
Have you ever had morphine before?
I don't think so.
Okay.
just do the process of getting sufficient analgesia into the lady so we can position her arm, you know, in preparation for movement. We're also, because of the nature of the injury and she's got an open fracture, we're going to give some coamoxiclav, which is an antibiotic, and what that'll do is just help to fend off any of the infection that she may have picked up from the injury in quite a dirty environment here.
You need
I
to
can pull
become...
myself up on you if you can take
yeah,
it.
I can take it. Okay, go.
The big lad, he's had his Weetabix today.
Stand me still for a minute.
Pam's unsteady on her feet. Her arm will almost certainly require surgery.
Turn round, we can bring the chair behind.
Yeah, okay, you say when the chair's happy. Okay. So if you just step back...
You go to a sitting position now.
Yeah, you can sit down now, it's behind you. So just trust us, Pamela, you're all right. Keep going. Well done.
Fantastic.
Well, you guys are bent, so you shout when you're ready.
Go on, lift then, so it's ready, steady and lift.
There you go.
Should have done a diet.
To be honest with you, you're one of the lighter ones.
Well, you're a smoothie.
I am. That's what my missus says.
Pam's going to be flown to the major trauma centre in Hull. Orthopaedic specialists are on standby to examine her arm.
That is from 98, lifted from scene.
Pam's test ride had been going well, but despite her fall, she's asked the seller for first refusal on the horse. It could be a while before she's fit enough to ride her new purchase, though.
Open fractures are, well, very visually quite disturbing, really horrific for the patients that suffer them. As soon as the bone and the tissues are exposed to open air, there's massive risk of contamination, and that can significantly slow down the healing process. It can mean they stay in hospital longer, it can mean they're off work longer, it means they're in pain for longer.
Cautions warning, lights are mute.
It's all looking good left, Chris.
Tail's turned left. If I do that...
That is from 98, landed Hall.
Despite morphine and other painkillers, Pam is still in great discomfort.
Give it a scale of 1 to 10, what number would you give it at the moment? 7 or 8.
Pam will be driven to A&E for x-rays that will guide surgeons in repairing her arm.
I would have thought, looking at you, probably will be, unfortunately, needing an operation on it.
Pam's passion is riding, but her injury may have stopped her hobby dead in its tracks.
First of all, just check the airway. Airway's clear.
Every year, more than 150,000 members of the public are trained to do CPR in the UK.
You can stop at that, thank you very much.
And for victims of cardiac arrest, having a first aider present often makes the difference between life and death.
Auto triple brief. Engaged. Clear departure, 12 o'clock.
HeliMed 99 is scrambling to a new housing estate in Harrogate.
That is from 99, no, we have lifted.
With paramedics Matt and Daz on board.
We're headed to a gentleman that's fallen on a building site. We believe he's in traumatic cardiac arrest. With a medical cardiac arrest, it's normally due to some underlying cause. It could be something to do with your heart or other causes like drowning. With the traumatic cardiac arrest, we're looking for quite specific sort of injury patterns. So the key things we can do something about on scene. Blood loss, whether that's external or internal. Hypoxia, we can try and ventilate the patient.
4 minutes. So at 12 o'clock, mate. We're looking at the southwestern corner, obviously.
The patient's workmates are keeping him alive, for now.
CPR is very important in cardiac arrest. Traumatic cardiac arrest, again, if there's quite significant blood loss, we may be pumping on an empty heart. So again, it's quite important we get volume replacement in there quite early.
That is from 99. We're about a minute out. Going to be preparing for land shortly. Anybody on scene yet?
Yeah, 99. There's an RLV apparently on the DCEA on scene of it.
Hey, firm, thank you. I think we've got visual preparing to land.
Visual DCA, 3 o'clock lead.
Got it, thank you. A little bit of dust pickup, and we'll just confirm how bad the ground is once we're down.
Dust can blind helicopter pilots in the final moments before landing. Pilot Lee is taking no chances.
Speed's good, height's good. You've got good access. There's going to be a little bit of dust, guys, but shouldn't be a factor. Good all round. Yeah, okay, we're going to go down on that, mate. Oops, fences have gone. Oh dear.
Alright, mate, I can get through there now.
Daz will take over the patient's care from local paramedics. And there's some good news.
He is currently in Rosk. He's just round the corner.
Round the corner. Okay. Cheers, mate. Thanks.
Rosk means his heart has been restarted. But Alan Easterby is still fighting for his life.
Witness collapse. He was initially cardiac arrest, good bystander CPR performed. Yep. When I got here, it was a VF arrest. He's had one shock that's brought him round into what is possibly fast AF or SVT.
Alan's collapse is a medical mystery, and his heart trace contains few clues. His workmates saved his life.
What happened, he was just sorting the string line out, ready to do the block paving, and then it just as he was coming across to adjust it, collapsed onto the floor. One of the lads came round to get me being the first aider. Came round, just started CPR. 5 minutes, 7 minutes, something like that. And then the first responders come up, and then obviously the first ambulance came.
A cardiac arrest can be caused by a number of things. The team aren't yet sure exactly what it is in this case.
Well, he's a VF arrest, so he probably should go to Leeds.
Defib came on at 15:45.
15:45, everyone now.
Yeah.
The ECG printout shows Alan's resuscitation second by second.
16:01. First shot 15:46.
Okay, yeah, cool.
Another 3 or 4 minutes of good CPR.
While Daz and the team look for clues in his ECG trace, one of the builders is calling Alan's home.
Hi, Alan's had a bit of a turn at work. He was way.
There's nothing definitive,
there,
is there? So 3, but it's not consistent.
It's not going to. There's a bit of depression in V5, but nothing.
Not a lot to give to Cath.
No, I mean they should accept it based on the fact that it's a VF arrest, but.
What's nearest at the moment? What's nearest at the moment? Is the ambulance nearest?
An ambulance is nearer, yeah.
So let's get him on the DCL. Let's reassess. We might have something more established on the.
Yeah.
Alan could go back into arrest at any moment. His mates didn't notice anything unusual.
Did he complain of anything before he collapsed?
No.
Nothing at all?
No.
So he didn't say, I've got chest pain or anything like that? He's not complaining of anything today?
No.
He urgently needs tests in a cardiac unit.
Talking to the guys, he's not complained of anything at all prior to it, and he slumps against the wall and then just sort of slumps to the floor. So he's not complained of any chest pain or anything like that.
It could be a big adrenaline rush from a bleed, you're thinking?
It's possible, yeah. It's anything really. You can't rule anything out at the minute.
Daz will have to leave the detective work to hospital doctors.
Everybody happy?
Yep.
Ready, steady, lift.
What is clear is that Alan owes his survival to a first aid course.
Really good bystander CPR from his colleagues on the work site, and our responders got here really quickly and they managed to shock him in a VF arrest. So there's a really big emphasis on CPR now, especially in a collapse like this. So that good CPR has kept that oxygen going around his body until our responders got here and they managed to shock his heart back into a sort of a normal rhythm.
Alan is going to hospital by road. It will allow paramedics to keep a closer eye on his condition. He's still very ill. It's mid-morning at the Yorkshire Air Ambulance base, and there's a visitor.
Right, it's 3 switches to start it.
Yeah.
And I'm not going to show you which ones.
The last time Rachel, Matt and Dr. Chris saw 17-year-old biker Lewis Foster, he was unconscious and fighting for his life after an horrific accident.
The injuries I had was a fractured skull, a bleed on the brain, a lacerated liver, a shattered pelvis in 5 places, a broken arm in 2 places, a punctured and dislodged bladder, and soft tissue damage.
He spent 7 weeks in hospital and underwent 2 major operations.
Just like mad how I've been so lucky. Like something like that, I'd say on paper, it doesn't look good.
Your probability of survival, yours was 35%.
Oh, wow.
So the fact that you're here today and
it's mad, yeah. Really puts things in perspective.
But Lewis still has a lot of recovery to go.
Brain injury can be up to 2 years recovery time, and I've got to undergo a lot of operations still. My pelvis and my arms, so long way to go.
And his family, who went to the crash scene, have suffered with him.
I come from a family of bikers as well, and it's stopped all my family from doing what they want to do. And it's quite sad to see, but maybe in time will tell what goes on.
The airbase at RAF Topcliffe opened during the Battle of Britain. Now, when the scramble phone rings, it's once again to save lives.
Fuel. Okay, I've got 580 visual key.
Cautions and warnings.
They are clear.
Today there's an emergency near the coast.
Good left.
Thank you. Spirit's starting to come on there.
Paramedics Paul and Tyrone are on the case.
No, we've lifted, thanks.
No, Roger, thanks. The motorcyclist is believed to have a fractured leg and a fractured kneecap.
It's spring and another biker is in trouble.
We are coming up to that time of year that sun's out, it's nice and warm, people all want to get out of the motorbikes, and it does have an increase on incidents for us.
The crash has happened near the market town of Driffield.
So it's halfway down the yellow field. Right, yeah. Can you see? Yeah, I got it. Now when you There's a few gaps in that hedgerow up there, mate. Do you want to take your chance with it? I'm just thinking about easy access to helicopter. Yeah, okay, mate. I'll stick it this corner then. Yeah.
Harry's landing in a rapeseed field.
Good left.
Tyrone's bringing pain-killing drugs not always carried by ground ambulances.
Oh yeah, you're right.
Neville Burrows was out on his Harley-Davidson trike for the first time when he crashed.
Got some pain in this left-hand side at the moment. There's some pain in this leg, but I haven't got as far down as that yet.
No worries. My name's Tyrone, are you okay? Yeah, like that. With a helicopter. Is all this on you there, just from getting through the hedges?
Yeah, it's come down the edges. He got a bit of wobble on, and his rear wheels hit the edge and it's pulled him in.
Right. Neville crawled out of the undergrowth himself, potentially making his injuries worse. His biking mate Stuart was riding with him.
Yeah, but his new tie, he's been looking for one for a long time and just got it this morning. So we were going for a cup of tea and, well, we might make it, but he won't.
You want some gas and air for the pain?
Yeah, don't be in here though.
Neville, deep breath for me.
A bit of pain on left-hand side.
Left-hand side. Yeah. All down here, yeah? Right, okay. I'm not going to press hard, just take a breath for me. Any around the back?
No, not around the back.
Left side of the chest, upper abdo, so it's potential for the impact that is. Could have done a spleen.
Yeah.
A ruptured spleen is serious. It can lead to catastrophic internal bleeding.
Neville, can you straighten this leg for me? Can you straighten this?
He's in quite a lot of pain with his left leg at the minute.
When I stood up, the leg collapsed. I think it's below knee that it's gone.
Right.
We need to give him some pain relief so we can straighten his leg a bit more in a normal alignment, really. So then it'll give us a better idea whether there's actually any bony damage to his leg.
Little scratch, but all right.
Okay, relax, keep nice and still.
They're going to give him morphine for the pain.
It's a valve. Tough skin, aren't you?
It seems that Neville's a hard man in more ways than one.
You got lining yet?
Yeah, she has, I am. So you're all right with morphine, Neville?
Yeah, I've never had it.
Right, okay.
Tyrone wants to rule out other injuries before he straightens his broken leg.
So you're not tendering your pelvis or your groin?
No.
Nothing there. So we might get away with pelvis, but definitely chest and abdo. Right, Neville, I'm going to bring this left leg to your right leg, okay?
His knees come out of joint too.
You did have a good pulse anyway, so.
Did it?
Neville's new trike is a mess, but it could have been worse. Trike riders don't have to wear helmets. He was.
Let's crack on and get up to aircraft, all right? Just watch your head on the fin. Right, guys, we're just going to pop the head on here, then we can just push him up.
Keep coming.
Keep coming. Put your elbow in. Okay. Stab is re-engaged.
He's being flown to hospital in Hull, 25 miles away.
I'll start a helipad from there before I'll get any more yellow stuff stuck to the blooming aircraft. Right, okay, turning onto heading towards Hull. Looked quite well, to be honest, but just a lot of pain. On the further examination, he's got a left-sided chest injury, so just a bit of a concern there. In regards to his left leg, it's possible that it might have broken the tibia.
Desk from 98, we're on approach, Hull Royal.
Okay, wind does say slightly from the left, but pretty decent heading. Happy with the oxygen, thank you.
Neville's heading for the major trauma centre for tests.
We've got an idea on what we're treating for, but until you've had a scan, we don't know what's going on.
He's lucky to have survived his first ride on his new trike, and he may not be riding it again for a long time. It's time for tea at Air Ambulance headquarters as the late shift begins.
We're halfway down Green Lane.
But in the control room, a panicked mum is on the line to 999.
Guys, you might have a job. Just trying to get some info.
There's been a climbing accident on a rock face near Bradford.
It says fallen off a cliff edge. They've said he's down a ravine.
How old is the patient? It's 13.
Oh, as a kid as well.
Hey, just be careful, okay?
Right, I'll update you if I hear how.
T will have to wait. Paramedics Lisa and Gav are scrambling.
Good left.
On board today is flying Dr. Sarah. They're heading for a difficult mission involving the local mountain rescue team.
And she said MRT are en route, Gav.
Yep. Yeah, she said that they've activated MRT.
Yeah. There's a 13-year-old male who's fallen down a ravine, maybe about 20 foot. The person who's with him, or who's near him, is obviously very distressed about that and not able to give us too much information, but we do believe the child is awake and is breathing, which is great.
The accidents happened in a disused quarry at the top of a steep moorland hill. It's been raining for days, and even level ground is treacherous.
We're at risk as a team of falling down ourselves. We're trying to carry large amounts of equipment down a ravine. That's going to be quite dangerous. I mean, we can negate that with some of our own personal protective equipment that we carry, helmets and that sort of thing, but we do need to be a bit cautious.
Helimed 98 is giving them a bird's eye view of the accident scene.
Anywhere around here.
Visual DCN does.
This flat area here, can you see it in the 1 o'clock?
He's waving at us. Where you going now? Parallel with where crew are.
I'm thinking putting this down here and it's a flat carry out from here. Just below you to the right area, yeah.
Pilot Harry can't get them close to their patient. It's just too hilly to land safely.
I'll try and put it here and we'll see what happens.
EDS-98 with landing scene.
The team will have to walk from here, up a slippery track.
Hello.
Local ground paramedics have reached the boy first.
This is William.
Okay.
13.
Right.
He's been exploring and he's fallen off the top of there.
Right off the top? Right.
Yeah. Landed on his feet.
Yeah.
And then he's fallen back onto these rocks. He's just complaining of pain in his right lower leg.
It's a 20-foot drop.
Can you remember everything that's happened?
Yeah.
Okay,
yeah.
Where's the worst pain then? The bottom of your leg, is it?
William's mum dashed to the rock face.
He's been out playing with his friends and they've called me to say he's had an accident and fallen down a ravine. And then obviously I've come and found this situation here. And then obviously called the ambulance, panicking because I thought, how are you going to get to him?
It's been a big shock.
I was frantic, absolutely frantic, and I still feel a bit shaky, to be honest. I don't know what the injury is, but it could have been a lot worse had he fallen on his head or straight onto his back.
Now the team face a bigger problem, manoeuvring William out of the ravine to the nearest hospital. In West Yorkshire, the team are at the scene of a climbing accident in a disused quarry. Patient William is in good spirits, despite a broken ankle. Dr. Sarah is relieved and surprised.
William's actually fallen really quite far, so from the top of that has landed on his feet, which seems to have taken the brunt of the injury, and then he's toppled backwards. But it looks like he's actually just hurt his ankle on the right-hand side, which is pretty good given he's fallen so far. A mountain rescue are just coming round the corner, so hopefully they'll be able to help lift him out so we can take him to hospital. William, are we all right to put you in a little tent with Gavin there? Is that okay? We don't need to get too cold and wet.
He's going to be sheltered from the Pennine wind.
That's it, and it'll just heat up a little bit in there. There we go. If you've had an accident, being really cold is bad for you. Your blood doesn't clot properly, so you can bleed a bit more than you might have done otherwise. So it's really important to keep these people who've had any sort of accident really quite warm, which is the aim of that. So we've put lots of people underneath it, not just the patient, and they're just a lot more comfortable. Gav, how's his pain out of 10?
Pain was a 6 out of 10.
Yeah.
And he's now coping well with the empty oxygen.
Is it worth just some oral painkillers as well to get on top of things?
Yeah. You'll be banned from up here, won't you?
Yes.
He and his mates have climbed here many times before today.
I didn't realise it was as bad a situation, because I said to his friends, just hitch him up and bring him down to a road, yeah.
Oh, but that's good that they called you straight away and didn't try and manage, didn't they? So that's brilliant.
Mountain Rescue are going to carry their patient a mile down to the nearest road.
So it's going to be a bit of a... See how we go, really, because as you can see, it's quite undulating ground, so you just have to be careful and it's very slippery. Someone else at this top side. Race, lift.
You push really good like
Hold on with you. Brilliant.
The realisation of what might have happened is dawning on his mum.
If at any point you're not happy, you want to stop, just tell them, all right? They can stop and give you a ring, all right?
He's been very lucky.
The rock's just been abandoned when the quarry finished working, and a lot of loose rock about, so quite slippy. It's a damp day today, we've had quite a bit of rain. We're using a bell stretcher, which is a very rugged stretcher, been around in mountain rescue for a long time, and it's a good stable platform to carry him on.
When we get him back there, Gavin's just going to have another quick look at him, just make sure nothing's changed, check his observations are all the same. His pain control's been really good, but we want to make sure that he's got plenty of painkillers on board for his travel.
We'll give you another check over, just from top to toe, make sure we haven't missed anything. And if we haven't, the ambulance crew are going to take you off to Bradford for an X-ray on that ankle. Are you happy with that, yeah?
Yep.
We'll get your mum on board as well, she can come with you. OK?
Thank you.
Good lad.
William's mum has forgiven him already.
You have me doing some exercises today. Sorry. I'm shattered. Sorry. All right. Let's take that one.
Mother and son are off to hospital. William may need surgery on his leg, but it could have been much worse.
The worst case scenario is he could land on his back or on his neck, and he could have been looking at life-threatening injuries, but the way he's fallen and the way he's landed, he's been very, very lucky.
Ambulance service, is the patient breathing?
When someone dials 999,
And are they conscious?
the air ambulance dispatcher is often listening in to the call. And today, Dr. Andy and the team are airborne to a former mining village before the call is even over.
Doncaster there, good afternoon, Helmet 98 Alpha. Just lift nostril 5 on board, climbing to 1,500 feet and went outbound to Cuddiff.
It's another young boy who has fallen, this time from a roof.
About 3 minutes to run. Cheers.
98, what's your message? Yeah, just a quick update. I picked your patient up and moved him into a house. You haven't got a DCA, but it's just pulled up on the scene of it.
Oh, yeah, got the DCA there. Right, I can stick it. See this field with a play park on this end of it?
Yeah.
I can stick it on that field there with it, just on the other side of the White House.
Yeah, visual with that.
Pilot Jeff needs to get his medics to the boy's home.
Desk from 98. We've got visual on scene.
Well clear of those wires.
Yep, it's gone.
Roger.
Jeff's landing just up the road, to the surprise of the local dog walkers.
31.
Yeah, Tom, we're on foot. We've landed at some way off, so we're going to head down. If you get an update, let us know. But
we're going to an 11-year-old who's fallen from a window. We think that he's been picked up and moved back into the house. We've got no official information at the moment.
Their 12-year-old patient was trying to retrieve his football from the roof when he fell.
See this one, don't?
Local paramedics have started treating him.
Tyler's 12 years old and he's fallen off a roof about 8 foot.
Up at club, yeah.
Yeah, he's got quite a nasty laceration to that leg. No other obvious injuries. He's had 1 gram of paracetamol, he's just had 400 milligrams of ibuprofen.
Hey up. How's it feel now? Is it still hurting?
It still stings.
It stings more than hurts? Yeah? All right. What we're going to give you, we'll get you a syringe. Yeah? You know what a syringe is, don't you?
Yeah.
And we'll give you something in that to take. Have you had Calpol before?
Yeah.
It's a bit like that, but stronger. All right?
Tyler's frightened. It's a large wound that'll need stitches.
Right, just open your mouth. All right, I'm not going to put it all in. I'll put it in steady. Just swallow that down. We're going to put something over the wound. You've seen a
a bandage before, aren't you? We're going to put that over, but you need to lift your leg. Don't move it yet, but we need to lift your leg up off. No, it just needs to come up off settee so we can wrap it round properly. Yeah. Tile, can I come under here? Just lift it from there. All right. Okay, that's all I'm going to do. I'm not going to do all else.
It looks like Tyler's had a lucky escape, but Pete must look for other injuries.
All right, does that feel a bit stingy? Just because it's wet, that's all. I bet that was cold more than all, isn't it, that? Okay then, that's Worth Street done.
There's no sign of more serious injuries, despite the height of his fall.
Tyler, just bend that knee up for us. Note on that leg is that it's just...
Pete decides this is a case for the local A&E.
See what we mean, just to keep it straight.
He doesn't need a flight to a trauma centre.
Right, so we are there now then. Have you any pain anywhere else at all? Great stuff. Right, just hop your bum round onto there.
Tyler's off to Barnsley Hospital by road. The team will fly back to base to brace themselves for another emergency. Tyler had an overnight stay in hospital. He needed 18 stitches in his leg, but he's now fully recovered. Veteran rider Pam suffered a very complex break to her arm that required a skin graft and metal pins and plates. She was very pleased to see the air ambulance.
When I saw them coming, running across the field in their orange suits, honestly, they did look like my heroes. I saw this guy come running along and I thought, oh, thank goodness.
Pam was in surgery for 5 hours.
The surgeon going in told me that it was what he called the mother of all fractures. He said it's really nasty and it'll take some time, so I was a bit shocked by that because I thought I'd just broken the one bone that was poking out, but apparently my elbow had shattered into like 11 or 12 pieces.
Now she's a big supporter of the Air Ambulance charity.
They are brilliant. They actually are heroes. I mean, I only broke my arm. There are people who break necks and backs and their life is hanging in the balance, and these people go out to them in all sorts of conditions. So I cannot say enough good things about them.
And the horse? Pam didn't buy it in the end, although she'd have liked to. Biker Neville, who crashed his trike into a hedgerow, suffered major ligament damage. It took him over a year to fully recover. He does hope to ride again. William spent 5 days in Bradford Royal Infirmary and needed an operation to reset the broken bone. He's now fully recovered. Builder Alan spent a week in hospital, 3 days in intensive care. He owes his life to his workmate.
Andy coming down and doing the CPR on me definitely saved my life. I'm very grateful to him and everybody else that was involved.
For his wife, alerted by a telephone call from the site, it's been a traumatic experience.
When I first saw Alan in hospital, it was, well, I didn't think that I would actually get him back. That was my first thought, having seen him. But now we have him back and it's just so wonderful. You hear people say, thank you's not enough, and it really isn't, and I don't know that there's another word to describe that. But we are just so eternally grateful.